The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everybody, or good morning. Welcome to lecture number 29. This is the one before our last lecture. Tonight we will be talking about canker, keratoma, and thrush. The title picture is a draft fowl, and I thought he just looks like a little teddy bear. However, as cute as they are as foals, and I once had one here, they're not quite as cute anymore once they weigh 1,700 pounds and are approaching 17 hands. And this one looks as if you could just do that. So tonight is not a lecture for the squeamish. There is a lot of ugly pictures, and unfortunately that's just the way it is. But I think it is important, and even so I hope that you will neither encounter canker nor keratoma in your life as a horse owner. I have had to put it in here because you have to at least recognize it when you see it. And I think that a lot could be done if these problems were recognized earlier and not just in the stages where they need surgical intervention. So let's start with this. Canker is in natural hoof care thought of as a proliferation of the corium. It usually starts in the sole corium or in the frog or in both. The resulting tissue is very vascular, and even the dull side of the knife makes it bleed. It also is very sensitive as nerves have grown with the new tissue. Correcting the hoof form and getting it as decontracted as possible is the first action of the hoof care professional. A holistic veterinarian will be of great help to this situation. How does canker usually develop? It usually develops around the frog and usually in a much contracted hoof. Also, there is usually thrush present at first. So we have here something that one would recognize just as thrush. And then this becomes a little bit more thrushy everywhere. And then this goes fairly fast. The last pictures were from June 21. This here is June 30th, so we're talking 9 to 10 days. And then it looks all of a sudden like this. And the horn part falls off, and under it is a mass that looks so like old cheese, and often also smells like it. So this is just a little bit, this picture here is just a magnification of the other one. So that is what it looks like in the beginning. Then when it has become more obvious, then we have it looking like something like this. And that is pretty bad already. And this is very soft to the touch. It's not like horn at all. It's more like terry cloth. These are all examples of Kenga hoofs, and they all have one thing in common. They come from they are very contracted hoofs, all of them. So it seems, and I got a lot of these pictures from the Yahoo group Equine Kenga, and on this group it is vehemently denied that contraction has anything to do with this. And once in a while some barefoot trim expert goes in and tries to say something about the contraction, and no, this is not the cause. Okay, so be it. It is the cause, and it makes a huge difference. I cannot imagine why a corium would try to proliferate if it wasn't under extreme stress and pressure. So, and I have never seen it in hoofs that were nice and wide and expanded and had a nice wide frog that was functioning properly. Doesn't happen. But you can see in all of these hoofs here, there is lots of overlaid bar, overlaid sole here, long bars here. No, sorry, can't even tell anymore what is what. This is the bar, and here is all bar. And there is certainly has been thrush present, so that's the same thing in this hoof. There's lots of thrush here. And thrush also usually comes with contractions. We will talk about this a little bit later. And you cannot deny that this is a contracted hoof, and not just in one way. So working on your horse's hoofs that they are not contracted is really, really important. Here we have a Kenga situation. On the very left side, you can see again that this hoof is not trimmed for any sort of decontraction. This is just kind of rounded off in the front. Never sure for what that is, except to take toe height off. And it starts to really impede the frog and the sole. And then in the middle picture, the hoof is now all of a sudden trimmed, but a lot of Kenga has already taken over. Even so, I don't think that it's so bad that it couldn't be surgically debrided. That means the veterinarian takes this tissue off and basically caulders it off. But this is something for a veterinarian, not for a hoof care professional. And then they put the horse down, because guess what? The horse doesn't want to step on this anymore. And it could just be that they couldn't afford the surgical removal. I got once quoted $2,500 for that. So if somebody doesn't have that and didn't expect this, and there's many people out there that don't have that kind of money, then they put the horse down. And the horse can definitely not step on this. This is very painful. So they put the horse down and they took the hoof apart, and what I see here is, this is, in my opinion, lateral cartilage, and then here is some of the Kenga, maybe. Really hard to tell from this picture. It's not very clear, and it wasn't labeled what it's supposed to show. So but this is how Kenga can look as well, just to show you what it can look like. Here we have a series of pictures, 7, 8, that show a progression of cancer or the healing of cancer, something like this it was labeled as. and we're starting in September, third week of September. They discover the canker. They didn't discover it before. I can assure you it was there before. It doesn't just pop up overnight. But if you don't pick up your horse's feet every day and keep them trimmed properly, then you may just miss this. Again, we have a contracted hoof here, fairly severely contracted hoof. 2 days later, nothing is fixed on the hoof form, but they must have kept the horse in a drier, cleaner environment, so it almost looks a little bit better. But you can see here how immensely high the bars are on both sides and how long the heels are. Well, they go to here. And this is not really a uncontracted heel situation. This is pretty bad. So then they start treating it with betadine wash, and that helps a little bit in the canker situation. It certainly doesn't help overall the health of the horse. We have still immensely high bars. We have very high heels. Nothing gets trimmed. When a horse gets something like this, nobody thinks about trimming anymore. And that's really a pity, because by lowering the heels to about here, you really could get that hoof to open up, and then you could get this maybe, just maybe, to heal. I still would prefer to have a veterinarian on board for that. Here it actually looks fairly good, and it is labeled before first surgery. Again, nothing on the hoof form has changed, and now they have I don't know whom come in. It's not labeled that a veterinarian came in and did the debriding of the cankerous area, but this was before the first surgery. And this is 4 days after the first surgery. I assume they put a wrap on, and that kept whatever they put on as medication, some kind of powder, under wraps. And that is okay, but again, the hoof form doesn't change, and that doesn't make anything better, because for anything to heal, you need circulation. And with high heels, high bars, thick sole like this, circulation is not what you get. So then they had a second surgery done, and from the time frame I can only assume that they did this within 2 months several times. So, and again, I assume a veterinarian did this. I would hope so. If you are a hoof care professional and you cut into this like this, you are crossing the boundaries. We are not allowed to cut into anything. We are not allowed to cross the bloodline. This is really important to remember. That is veterinary work, and it should stay that way. Then they had a third surgery. Now here the frog looks a little bit better. The trim even looks as if the horse got trimmed a little bit. So that is a little better. And this here is not quite 2 months later, 1 week after the third surgery. Now I'm not sure that there is any progress made. What I am now sure is that whoever trims this horse does a terrible hack job. And you can see this on the sole, on all the divots that are hacked into the sole. Maybe their knife is dull. The medial bar is very high. The lateral bar is trimmed at the solar concavity. The heels did not come down enough. So again, there is not much help done for this horse in the trim department. And that is what, is this progress? I don't think so. It cannot be fixed without a correct trim. That's the same like with founder. A rotation with separation cannot be fixed without a correct trim. It has to have a correct trim. Here we have another canker comparison before and after whatever they did. It's a little bit better. It's certainly not gone. And despite the fact that they trimmed it, they didn't really trim what needed to be trimmed. And what needed to be trimmed are these high bars, because they do crush off the blood supply to the frog. And if the frog cannot regenerate from below, then how is it going to get better? And we have still immensely high heels here and super contracted heels. So this is really a difficult situation. And when you are trimming a horse like this, then it is really important to bring this hoof in some stage of decontraction. However, when we're talking about trimming, we have to always leave the wall above the level of the canker. You have to leave the wall standing a little bit higher than the canker, otherwise the horse will not step on this. And if a horse doesn't step on the hoof, you will not get any decontraction. You have to have weight bearing, and I mean full weight bearing, in order to get real decontraction. This here are pictures, the next two are pictures from our colleague Mandy Iserton in Australia. She was called to this horse that had shoes on and quite hideous feet with the shoes on, and then he had this growth out of the back of his hoof, almost out of the central sulcus or between the hoof bulbs. Here you see it as well, where it comes out. And she sent me these pictures and said, what do I do? And I said, call the veterinarian, let him decide what to do. She did that, and the vet came and surgically removed this, and then she could trim correctly, and she had taken the shoes off already. Then she could trim correctly, and the horse, to my knowledge, healed. At least that canker situation healed. Now, here we have the canker without the shoe still on. This is how it looks from the side view. But when I see something like this, I'm always thinking, better Mandy than me. Boy, is this going to be difficult. And a long haul to get enough pressure outside onto this hoof so that it will come outside the vertical again. It is on both sides inside the vertical, and that is really difficult to deal with. This here is a couple of pictures of our colleague Miriam Brown in Quebec, and you see here in the back something similar to that horse from Mandy. It's just this is canker without a question. And this was an after picture, and she actually got it under fair control, not all the way healed. Unfortunately, she got fired before the job was done. This is often happening to us because we are not willing to do what the owner wants us to do if it's not right for the horse. And she was kind of moaning to the owner that he should turn the horse out and give it 24/7 outside movement and give it a clean paddock and not having the horse stand in a stall. And the owner didn't like to be told what to do, and he looked for somebody else. However, when I see this picture, these pictures are, I believe, 4 to 6 weeks apart. This frog width to this frog width is pretty amazing. If you just compare here the middle of the frog, how wide it has become, this is pretty good. And that just happens with correct trimming. And you can see in the back, at least this whole area has fallen off. And yes, there is still some bloody tissue here, and there's still some canker here, but I think now where the hoof is now, this could be remedied with just cleaning it up a good bit and keeping it clean. But as you can see in this picture, cleaning up and keeping things clean wasn't part of the management here. And who knows if they even recognized what they had here. It's amazing how blasé people are about their horse's hoofs. Only when the horse gets lame do they start to look a little bit closer. This here is a little bit more severe. We looked at this horse already before when I said when it's beyond help. This is the horse that had canker on the left fore and in the long run lost the hoof capsule on the right fore. At the time when I had this horse in my care, I was told by my mentors that one could fix anything with a good trim, and I just should trim the bars more out and that hoof would widen, and then everything would be okay. Unfortunately, as I said earlier, when you do not have weight bearing on a hoof, then it does not widen. And when you have this much sensitive tissue standing above the wall, trimming more doesn't help. It will not widen. The hoof will only widen under weight bearing. And a year later it looked like this, but we still had cankerous tissue here and here, and the hoof would actually collapse more and more because it had no weight bearing. And even so I got rid of the canker on the sole, this whole frog area was standing above the wall level, and the horse was just not going to step on this. If I would have known then what I know now, this horse would probably still be okay, but we don't know that. These are the things that I think I feel I have to share with you. The bad ones as well as the good ones. There are mistakes made, and one of the biggest mistakes is that one thinks he can fix everything with a good trim. And it's just sometimes so beyond our help. I have talked about this a lot already, so I'm not going to go into this again. This is about all I can tell you about hoof canker. If you see something that looks remotely like this, call a veterinarian, ask a veterinarian if they ever have seen canker, if they have experience with this. I had a note from Dr. Cook this morning, this afternoon, after he was on the call, and he sent me an email and said if I would have known then what I learned today, horses in my care would have been a lot better off. And I think we learn something every day that makes us better horse managers. And horses that are over years and years in a very contracted state, especially when they are very heavy, they seem to tend to this disease, Hufkängel. Please call a veterinarian and have the veterinarian help you to get rid of this. Don't do this alone. If you have never seen this before and you suspect it that it could be Kängel, send pictures. If they don't want to send them to me, send them to somebody who knows. I'll be always glad to look at pictures, and I'm not shy. If it gets too much, I'll let you know. But don't hesitate to send anything where you don't know what it is, and ask. I have no problem to say I don't know. So once in a while I look something up. However, since I'm on that subject, before you ask me, you may go to Google and Google it. There's a lot of information on the internet. So not sometimes I get questions where I just go and Google it and then send them the link. But that makes me feel like information central, and that doesn't feel so good. So let's get away from the Kängel and to keratoma. Another thing that I hope you won't see a lot or at all, because equine keratoma is an uncommon hoof disease, best described as a tumor of the keratin-producing cells of the hoof wall. The mass is interposed between the hoof wall and the underlying coffin bone. Sometimes you see a small semicircular area inside the white line horn at the toe. Here the coffin bone has been destroyed to some degree, and the hole in the coffin bone has been lined with and filled in with horn. Often this horn dries out quickly and crumbles away, leaving a hole in that area. This may happen when a horse was shod with a toe clip. With every step, pressure is exerted onto the frontal area of the hoof. This may also happen when you have a break in the hoof capsule for a long time and the edges of the break push inwards. So if you have a break here that goes really deep in, and when the horse becomes non-weight bearing, the edges of that break push kind of inwards and push that pressure into the lamina area and therefore into the coffin bone. Smaller keratomas may be found on the side of the hoof where the hoof has been quicked. Quicking is when you nail into the corium. This here is a coffin bone with typical bone loss through unphysiological pressure. Now, we know that there is not a toe clip and a lateral clip. You either have toe clips or you have side clips. I have never seen a farrier do 3 clips on one hoof. And this is just a demonstration what could happen, not that this is what happened in that particular hoof. But that I haven't seen a hoof with 3 clips, a shoe with 3 clips on, does not mean it doesn't exist. Today I trust that anything is possible. Many horses have keratomas and never show signs of lameness. When a radiograph suggests a keratoma may be present in a lame horse's foot, the horse will have minor surgery to remove it. In most cases, the horse improves. The cause and treatment of keratomas seem to be only of mild interest to most veterinary practitioners. Unfortunately, this is only seen in the magnitude that it exists once the horse becomes really lame. And I just thought in this context it may be really not a bad idea if you own a horse, if you get base radiographs in the same way as you know your horse's temperature, you know your horse's respiratory rate and your horse's heart rate, you also could know your radiographs. And have your horse trimmed up just before the veterinarian comes and takes the radiographs, and get a baseline. I just did this on my horses. I just had lateral views made of the front feet, and it was very revealing, very interesting. So now I have these base pictures, and I will have new ones made in a year or two. I hope you can afford this. This is not gonna be the end of all times. Combine it with something like getting your coggins pulled or whatever there is, so you don't have to pay an extra farm call, and then it is bearable. Just some lateral views of all 4 feet. That would be good. Then you have a baseline, and when something happens, then you can compare. This is where we were then, this is where we are now. And that may take out a lot of guesswork out of the veterinary work. To summarize this, the keratoma is an irritation in the hoof wall, or perhaps trauma or some other cause which can disrupt the keratinization pattern in the wall. The horn tubules grow abnormally and form what could be called a horn-filled, non-cancerous tumor. Since it is caught under the hard wall, it presses against the soft tissue of the laminae that surround the coffin bone, or may press against the coronary band and disrupt growth. And it would then probably cause a horse a lot of pain. Here you have in these pictures the removal of a keratoma. You see here a pressure cuff so that the blood flow is diminished to the hoof, and the veterinarian is opening this up, and what they are holding here between the shoe pullers is the keratoma as this extra horn came out of this area. This will grow from the top down and will be fine if it was removed properly. If you read the vet journals and farrier books from Europe, you might think we are missing something. Just as the Eskimos have 100 words for snow, the Europeans have a word for every specific condition in the foot, and keratomas are classified into groups so that they start to sound pretty interesting. Dr. Hans Kasselines of Italy says that the German vets and farriers differentiate strongly between a regular keratoma, which he says originates at the sole, and a strand-like tumor that runs the entire length of the wall and originates at the coronet band. Dutch author Rob van Nassau, in his book Hoof Problems, classifies equine foot keratomas into 3 types: fan-shaped, toe, and sidewall. This would be what we name quarters. So this is about all I have to say about keratomas, and I had to take this from reading material and from what I have learned in school myself, I haven't seen one yet. So, but if it comes up, you now know a little bit more about keratomas than, maybe you know a little bit more about keratomas than you knew before and have seen a few more pictures. So that brings us to the last part of our lecture, and that is about thrush. And we had talked about thrush already a good bit in previous lectures and question and answer sessions. It comes up again and again. This is, unlike canker and keratoma, something that happens quite often. And the hoof I have here in front of you is one absolutely without thrush. Beautiful frog with just a small indentation as the central sulcus, and really nice wide hoof with, it's a hind hoof, with a very healthy frog. This picture comes from Ove Lind from the Swedish Hoof School, and Ove Lind has his own take on thrush and how it affects the entire horse. And we'll talk about this in a moment. Now this here, in comparison, is a picture of a hoof with definite thrush. No question about it. If you can insert the hoof pick between the hoof bulbs and the tip of the hoof pick comes out in the central sulcus, you have major thrush. And this is a real problem and should not be taken lightly. Now this is a horse that either was just de-shod or will get a shoe back on, in which case this thrush is most likely not going to go away. It can reach really deep and it can be very painful. So this is a picture from Ove Lind from the Swedish Hoof School, and he talks a lot about how deep the thrush can go in the back of the hoof. This here is the frog horn, what you see here, and this is all infected with thrush. All the gray area is thrush. This here is inflamed tissue. So this is really rather severe. And what he's saying is, even so you may not see it, but a horse that has thrush does not step on the heel with full weight bearing. Therefore, over time, the heel will get higher and higher. And as the heel gets higher, you get something named mechanical founder, because then the front gets overloaded, and we have been through all of this. The heel gets higher, there's more pressure on the lamina corium, there is eventually stretching of the lamellae, there is pressure on the circumflex artery. We all agree about this. There is no question, and Ove Lind is pretty close to what I have learned. This thrush thing, he says this is the cause for many founders. And I'm not disputing this. This is absolutely possible. So we touched already on the causes for thrush during the lectures about contraction. With high heels come always high bars, and high bars shut off the blood supply to the frog tissue. Thus, healthy frog tissue cannot be created any longer in a sufficient amount, and the frog deteriorates. Once all the pathology that come with high heels are thoroughly removed, the frog will regenerate rather quickly. Sweat glands in the frog sulci provide for a damp climate in the tight folds. In this way, the elasticity of the frog horn is ensured through the sweat glands, And the anaerobic bacteria which live here and which suppress germs find a suitable environment. In the confines of the frog sulcus, the continually formed horn cannot be worn away in any other way, so that it does not become ever tighter in the sulcus than run through decomposition to a fluid mass. This decomposition is done by anaerobic bacteria. The acid produced is well known for preventing rot and putrefaction, which is why we have, from time immemorial, preserved vegetables in acidic form. We name this pickled cabbage or sauerkraut. That is a preservative. A decomposition of frog horn into an acidic mass is therefore the natural course of events in the frog. It is illogical to remove this moist acidic environment, because without it, disease and putrefaction can take hold in this region. If, however, this decomposition grease does not smell acidic, but rather musty, rotten, a high sensitivity in the frog region is also noticeable, even lameness. In this case, we are dealing with thrush. The cause of thrush, as with most other hoof problems, lies in reduced circulation and thus restricted blood supply to the hoof. Too little oxygen and nutrient-rich blood reaches the frog corium, and too little horn is produced in relation to the constant decomposition of the soft horn by bacteria. The frog becomes weaker and weaker. With dehydration of the hoof, cracks appear in the thin sheet of soft horn, which then becomes infected. Wound discharge is a slightly alkaline environment and further helps the putrefactive agents. Because of the poor blood supply, the corium cannot heal. The frog region is sensitive to pressure to the point of lameness. The contracted hoof must be brought to a normal open shape in which the frog corium will again optimally be supplied with blood. So I like to go a little bit back here to the first set of pictures and show and explain a little bit what you see. This first set of pictures is 6 weeks apart. This is how the hoof looked before the very first trim, and you see definite thrush here and a very slim frog that is kind of bound in here on both sides, so this is not something that looks healthy. 6 weeks later, this hoof looked like this. We have some bruising here in case you are concerned about this. But here we have a much better looking frog in the width. We have here better looking bulbs. They are a little smoother. You see that this here starts to open up, and that's the way it goes. Before it fills in, it opens up first as the hoof gets wider in the back. And then when you have that width, then it can fill in and regenerate. In this set of pictures, we had here in the left picture, this horse was already for 2 years in the care of a barefoot trimmer, but as you can see, we still have pretty high bars here. We have definite thrush here and not a very wide frog. And then they brought me the horse in the hoof clinic, and the horse wasn't lame, but she was not very rideable. She was running away on the saddle. And this took a while to straighten this out. What I did with this horse in this case is I hyper soaked her, and these are pictures from the same horse. this horse was a lot in water. She got walked in warm water, as warm as I dared to put it in the soaking boots. And then she went with the soaking boots into the walker, and the water was replenished because it kept flying out of the soaking boot, but it did the trick. It really brought the back of the hoof open, and then she also got soaked in apple cider vinegar at the time, and got trimmed quite often. And about 3-4 months into the process, she got a whole lot calmer on the saddle. And but this didn't go quickly. Don't think this happens overnight. This is something you really have to stick with, and like always, you cannot get any real healing without movement. You have to have movement, you have to have soaking, and you have to have a correct trim. I hope so. Throughout the course of this webinar series, this has become clear. Movement, soaking, trimming, in that order. Movement being the most important. But they cannot exist without each other. They all have to come together. So nutrition, this here is the same horse, different foot. Nutrition also seems to play a role. Do feed feedstuffs low in sugar, as sugar feeds fungi and enhances the thrush through the bloodstream. Soak with colloidal silver or effective microorganisms or oxine or clean tracks or white lightning. These are all the possibilities that you can enhance. If you cannot soak in stuff, use some cotton balls and put some colloidal silver on the cotton ball and then insert the cotton ball here. You have to do this every day. That's the long and the short of it. After treatments, like after soaking, dry the frog off and apply zinc oxide ointment. Desitin, the stuff you put on babies' bums, over the frog and work it into all the cracks and crevices. The zinc dries this whole area out and really works on the fungi. Whatever you use, it is taking more than a week or two to get rid of the greasy looking frogs and tenderness associated with thrush. You should revisit your treatment plan, starting with a reality check about how clean you get the infected frogs on a daily basis, and verifying that the treatment you are using is appropriate for the thrush your horse has. There are several ways several things you can use, one of which is Pete Ramey's goo. This is a combination of triple antibiotic cream, such as Neosporin, and athlete's foot cream, half and half mixed, in a syringe and injected into the sulcus and any cracks of a thrushy frog. I have not tried this. I have heard from some people that it works wonders, and I have heard from others that it doesn't work at all. Again, then if it doesn't work, you have to revisit your thrush treatment plan and do something else. But give it a few weeks. Other treatments that do work are athlete's foot spray, athlete's foot ointment, jog itch spray, dry cow teat treatment ointment. It's named Tomorrow, available at all these vet supply stores. Many of these have some degree of success. Again, to use you have to thoroughly clean the frog and apply. Doesn't help to smear it over the mud. Organic apple cider vinegar soaks, you can make it as strong as 50-50, half apple cider vinegar, half water. You can soak in microorganisms. Again, you don't soak in straight microorganisms. You put 3-4 tablespoons into the water in the hoof boot. You can put oregano oil or tea tree oil on cotton wool and stuff it into the crevice of the thrush. If the horse allows you to do this. Some horses are so sensitive they won't let you push anything in there. Others are just fine with it. Avoid over-the-counter thrush preparations. Most are so harsh that they chemically peel the entire frog, leaving a scab-like covering that usually has more thrush growing under it. Many other natural treatments chap the horn and only kill superficial thrush, while the hardcore stuff is flourishing in the cracks and commissures. Many people ask about using hydrogen peroxide, bleach, iodine, sugardyne, and unfortunately all of these contain ingredients that destroy the thrush but destroy the frog along with it, delaying the development of a healthy frog. And if you have real contact to live tissue in here, these things like bleach and hydrogen peroxide are really counterindicated. So that is about all I can tell you about thrush. It, like so many things in horse care, it requires diligence. It requires that you do the same thing over and over again and don't give up. And that is really important. So I have one more slide here, and that gives you some resources for where you can buy these things like colloidal silver. This is the cheapest site I have found for colloidal silver on the internet. You also can make it yourself. I have a little device that makes colloidal silver, and I'll be more than glad to part with it because I don't have the patience to deal with yet another thing. So if you are interested in getting my colloidal silver apparatus at half price, let me know. I have not used Oxine, Clean Tracks, and White Lightning, but they are on many hoof care providers' websites touted as the cat's meow, and just like Pete's Goo, you have to try it yourself. That is what works, what doesn't work is for everybody a little bit different. Some people find the White Lightning stuff works terribly good and they are rather thrilled with it. I haven't tried it. I didn't know about it when I had horses with thrush in my care, and today I don't have horses with thrush in my care anymore. I still use colloidal silver. I'm partial to that. I like it rather well. If you don't want to do the 5-hour soak, which I think works best, then you can just use a syringe with a soft tip and pull some colloidal silver into it and syringe it directly into the frog sulcus after you have cleaned it. That may do some part of the trick. What I do is I take 2 or 3 plastic bags, grocery bags without holes in them, and pull them over the horse's hoof and secure them above the fetlock joint loosely with some duct tape. Every barn has duct tape. So and then I pull a Davis soaking boot over that, close the soaking boot, and then I syringe into the grocery bag the colloidal silver. Then I give the horse plenty of hay and leave him in the barn in the alley for 5+ hours in one setting. And that usually takes care of all the bacteria that come from the thrush. So that's something I prefer to do. And to preempt one question, no, you cannot use the colloidal silver twice. You can only use it once. So it's not quite cheap. Making your own is cheaper, but it's fairly simple, reasonably simple. Because having thrush in your horse is not a small thing. Do not take this lightly. Oh, he always had thrush. Doesn't work that way. You have to get rid of it. You have to work on it. Otherwise, one day you may end up with canker. So, now I really have scared you. And with that I will come to an end for today. One more little thing. We have still plenty of space in the December webinar partner horse. 1.5 hours, end of December. You have 4 different days and 4 different times to pick from. Go to Equine Soundness. On the front page you find a link, and sign up for that. I have a special time for the Australians at 7 in the morning, so that should be 9 o'clock your time in the evening. And I thought one time I can do this, get up for you early. So, any questions about canker, keratoma, and thrush? We'll start with Carla today.
Hi, Claudia. I was just curious as to why you put the colloidal silver in the plastic bags rather than just putting it in the Davis boot.
Because when your horse walks around, it sloshes the colloidal silver out of the Davis boot.
Okay.
Yeah.
Okay.
And it's too expensive to let it just go to waste like that.
Okay.
Thank you for asking. I forgot to say that.
And you're not diluting that in water. You're just straight colloidal.
Well, that depends what kind of colloidal silver you have. It comes in 10 ppm, 10 parts per million, 20 parts per million, up to 500 parts per million. So you need to see which one you're getting, and then if you have it very concentrated, then you can dilute it down. But you have to dilute it with distilled water.
Okay, great, thanks.
Yeah, thank you for asking. This was really important. All the little things I forget. That's why I have Carla, and she can remind me. Yes, Frederica.
Good evening. I have a question about the canker. You never trim the frog, that's correct?
Well, you can't trim the canker, and when it goes so far over, it usually eats up the entire frog or most of the frog. So when you have
leave it alone.
When you have already canker, you can't trim it anymore there.
Okay. Thank you.
You're welcome. Yes, Shira.
I had a couple questions. The first is, how do you tell the difference between thrush and canker when it's in its early stages?
You can tell the difference. The thrush is horn that is nasty, rotten smelling. The canker feels like wet terry cloth. It's a totally different structure, totally different tissue.
I had a horse several years ago that I trimmed that started out very thrushy and contracted and then developed canker.
Uh-huh.
and I wasn't sure if what we had thought was thrush was actually the canker, or if the canker just then developed.
It usually develops out of thrush.
Okay.
And then it becomes, it starts all of a sudden, and then it goes fast, as that's what I tried to show in some of those pictures. Within a week or 10 days, you all of a sudden that the horn over the canker falls away, and you have that canker underneath, and then it proliferates so enormously fast that you really cannot say to the vet, whenever you have time, come by. Something has
Right.
to be
So
done quickly.
She had called the vet, and the vet came out and removed the canker. And I have to say that after the removal of the canker, she refused to put shoes on the horse, which the vet recommended, and had me keep coming to trim. And the hoof decontracted so fast after that.
Yeah? Uh-huh.
And the horse had been lame up to that point. So it was really wonderful to see. And the decontraction was probably because now she was comfortable. She would put the weight on the foot.
Right. Uh-huh.
But the canker looked like used dirty cotton balls.
Right.
So that's another, thing to just kind of mention, because I had never seen it before. I had no idea what it was. And
Uh-huh.
the owner was the one who was reading an article in a magazine and went, "Oh, I think that's what my horse has."
Yeah. Yeah.
And she called me and she was like, "What do you think?" I'm like, "Sure."
Whatever. Yeah.
I had no idea.
That's why I thought I show you all these pictures, so there is a chance that when you see it you recognize it, and don't wait till it blooms into a cauliflower-like structure, then you have a lot more trouble to get it under control.
My other question was, very often I have seen in horses, after removing the shoe, a small hole at the tip of the toe in the white line.
Mm-hmm.
Now, is that the same as keratoma? Because that seemed to be what was being described.
Well, that depends how it is and where it is. I have not seen such, when it is, it has to kind of be inside the white line, directly,
Yep.
very, very close, and then when you dig a little bit after it, does it go away, or is it still there?
It was still there.
Yeah, then it's probably a keratoma, and then it depends how big a keratoma, if it makes the horse lame or not.
Because it eventually, that was my thoroughbred. It's now gone.
Then it wasn't. Keratomas don't go away by themselves.
Okay, because that was my next question, was if they could actually grow out.
No, I don't think so. That's not from. I've really tried to read up on this before I put this lecture together, and I haven't seen anything that they said, well, and if you just wait long enough and have the horse trimmed correctly, it goes away. Nobody says that, so I don't think it goes away.
Yeah, unfortunately, I don't have pictures of that because I wasn't taking pictures when I first got our data.
Yeah,
but
well, we all have our little regrets in life.
The other thing I wanted to mention was you mentioned tea tree oil or oregano oil. I've also had great success with lemongrass oil on thrush.
Yeah, and somebody said today grapefruit seed extract. So I'm not saying this is the end of all. This is what I have put together. But that works as well. Anything that puts pressure on the little fungi. Thank you, Shira.
Thank you.
Yes, Sandy.
Yes, I was thinking that the canker must be some kind of relation to proud flesh, with the
It is.
proliferation of tissue like that, as opposed to being something that might be more like cancer.
Yeah, I think the word canker leads us to believe that it is related to cancer, but I don't think so. This is not what I get. Proud flesh is more like it. But if you don't treat it, it will not go away by itself. But it's
And
absolutely treatable.
one other thing, I know early on I wondered about in my frogs on one horse. I saw this hairy looking stuff, and then I found out later that that was the actual horn tubules, and that the tissue around it had been eroded, and that all I was seeing was the horn tubules of frog, and it looked like hair.
Okay.
In case someone else had that same experience.
Do we have a picture of this?
You know, I might find one somewhere on my other computer.
Yeah. Why don't you look for it, and then we can look at it.
Okay.
Okay? Thank
All
you.
right, thank you.
Anyone else? No one? Off subject, what is the name for the lady in California who does the equine nutrition? Her name is Renata Mihalic, and if you please send me an email, I will send you her phone number or email address. I think the email address is dr.renata, RENATA, at mac.com. But I could be wrong. If that doesn't go through, send me an email. I look it up and I get you the information right away. Not a problem. Thank you, Mary. And it looks as if nobody else has a question. Then thank you everyone for coming. We have one more session next Tuesday. And you have a good week, good evening, rest of the evening, good day, and I see you next week. Goodbye.